Back in March, we did close the facility to the public, and it was determined offering child care for emergency personnel was our key goal. 30 was our max number of participants for the child care. Based on how to break those up into smaller groups, we had to also consider that leading into summer camp affected what is going to be closed. Both pools were closed at the start of the pandemic. June 15th is when we started lap swim for the indoor pool and for members only. We can keep the pool as a separate entrance and separate use area. We are going to expand the hours we're allowing members by appointment. We're going to go back to our regular Monday through Friday hours of 6 a.m. to 9 p.m. Unfortunately, we will not be opening the outdoor pool this summer, and the splash pad will remain closed as well. Also coming up in the month of August, the indoor pool will be closed due to our HVAC unit being replaced. Another aspect of our operations are rentals, and at this time we're not taking any rentals such as rooms, gymnasiums, even park shelters. Those are on basically hold until the start of fall at this point. Again, this is a process of a slow reopening. We're going to take safety for not only patrons but staff as our main concern as we try and get more people in to be able to use our facility. That's why we're starting with members. Drop-in basis is going to be probably the last phase in reopening. What we're going to try and do is incorporate either contract programs that we can set the number of people for those programs. The weight and exercise area upstairs along with the track, we are looking at how do we start that use area similar to lap swim, members only by appointment. So those are the things that we are working on currently and continue to open up more to the public. It's been a constant challenge, and we're meeting daily trying to figure out which programs are priority, what areas of the facility are priority, and how to reopen in a safe manner. We do check memberships, health checks, temperature checks. We wear face masks. We're asking everybody to wear face masks when they come to the facility. Again, we are going to take the cautious approach, but then also try and reopen as best as we can, allowing the public to be using our facility again.
Hi, I'm Jenny Garner at the North Liberty Library. We have been closed since March 17th, except for our curbside services that we've been offering throughout. Our target date to start allowing some public to come in on appointment only is July 6th. When you come to the library, the doors will be locked. We'll have our library concierge or consigliere, as one of our staff deemed it, greet you at the door. We'll ask you to put on a mask. If you don't have a mask, we certainly have some available for you here in the library, and through our mask program, there's one you can take home if you need that as well. We'll ask you to sanitize up and do your social distancing. Those are the things that we know are important for us to be able to stay safe and stay open. All of our staff are masked as well, and you will have walk-through time where if you are looking for books or materials, you can walk through the building, and it's a half-hour time period, and we ask that only one person per aisle at a time. We are asking people to consider a family warrior model, so that means one person would come in and get all the books for everyone in your family or all the materials so that we can keep as little contact as possible. We are also encouraging curbside to continue, so we'll be offering curbside service throughout this time as well. The notary and the computers will still be by appointment, and it's one person per service for up to 1/2 hour. We are keeping those times between the hours of 10 and 2 currently. The reason for the appointments is since it is only one person at each of those stations, we want to make sure you aren't running into other people. And we will have one computer available for kids to use as well in the teen lounge, one at a time, only one person in the lounge. While we won't be doing health screenings at the front, we are asking that you consider your own health. From 8:30 to 9, we'll have hours available for the elderly and high-risk folks to come in. So please don't come until 9 if you don't fit those categories. When you come in the building, you'll get a number on a carabiner, and you'll carry that with you. If your time is coming to a close, we will page you by your number and ask you to come up and check out so that we can get the next group of people into the building. You'll be scanning the books yourself so that we aren't touching them. It's one person touching the materials. As the items have come into the library, we are sanitizing every book and every piece of material. If items are on hold, we are quarantining those items for 24 hours before they go out. Staff wear gloves when they check items in, get them all wiped down and ready and put back on the shelf. If you are doing curbside, those items are also getting wiped down when we check them out to you. We're going to ask as you are browsing that you touch only the materials that you plan to take with you. If you touch it, please take it. That's kind of going to be our motto. We'll be looking to see how things are going and decide what we can continue to open up or continue to expand, and what service we might need to pull back on a little bit, depending on where we are in the county and what health officials are telling us. The main goal for us is to keep our community and our staff safe so that we can continue to offer your services. That's a smile.